a first aider, the person who bridges the gap between the time somebody is injured and when the medical doctor will take over, or before the clinical hospitals they take over. Resourceful. Here is being able to improvise, to make use of available materials at the scene of incidents. Never will you say that because there was no first aid kit, no first aid box, and as such I could not render first aid. First aid does not really require sophisticated equipment or material, like we said earlier. You should know how to make use of improvised materials. Somebody had a cut at home and is bleeding. You are not going to waste time. Get a clean handkerchief around you, a towel. Place on that area as an improvised material to stop bleeding. We should always know when you don't have a splint, for instance, somebody has a fracture, like I said earlier on, that before you move a fracture victim, you must immobilize the fracture. You don't have what we say splint. You could have metal splint, you could have wooden splint, which is not there. Cartons, newspapers, magazines can be used as an improvised, splints. So we must know how to make use of improvised materials at any point in time as a first aider. And again, I want to say you must be tactful to secure that confidence of the victim and bystanders, and assume control of the situation and evacuate when necessary. When we go back to number 3, being confident, then they look alike. You know, when you know something, you do it tactfully. You do it courageously. You do it without fear. So I want to say here that as a first aider, you must be tactful. And when people see the way you are handling situations, it builds that great confidence in them. I remember I always make reference to a case that happened some years ago. I don't forget that case. I always mention it in most of my training programs. Some good years ago, there was a fire outbreak in the market, Warden Main Market. At that time, I remember very well that the state fire service, they were very close to the market. But thank God they were able to mobilize, get their truck to the scene. But as they were struggling to get the hose from the truck to fight the fire, the NPA fire service men, they were already far from the scene, they were already at the scene. They came down quickly, they were already fighting the fire. But I tell you, I'm sorry to say this, the state fire service was still struggling to get the hose out of the truck. The place was crowded on that very day. Shortly, come SPDC firemen. The moment the crowd saw that SPDC were coming, they started jubilating. They just came down quiet. As far as the crowd is concerned on that very day, if the shell firemen just jumped down from their truck and the fire site, this shell firemen, the fire will just stay on it, so we just maintain. Even without them doing anything, it's confidence we're talking about. Because the public, they have that great confidence already. That this group of persons that came in now, they have good firefighting equipment, they have well-trained firemen. So I want to mention here that we must be very, very tactful when we are handling our victims. Empathetic. Place yourself in the position, that is where you place yourself in the position of the victim, as if you are the one in such pains. And that will drive you to sympathize with the victim. I want to say here that, you see, it is when you have such feelings, it drives you back to what you should do. Because you're always thinking that, oh, as if you are the one that is actually involved. Now, perseverance. Do not be discouraged. Continue in the course of action, because there are some time you may have done all that you were asked to do, or all you are supposed to do, yet the condition is still there. Maybe somebody is bleeding. You have applied pressure, you have done the person is still bleeding. Please persevere, just continue. Continue, because you must not leave your victim unattended. Once you have started first aid, you don't leave the victim until the victim is handed over to the doctor or to the hospital. Because if you stop on the halfway, the case can deteriorate. So for you as a first aider, you should know how to persevere. Even there are some cases, as you are attending to your victim, you know, because an injured person is like a child. He will not know the time he will start even abusing you, or even give you a knock or whatever. Anything can happen. Please persevere as a lifesaver and continue until the victim is handed over. Do not say, I have done all I am supposed to do. Since you are not getting better, sorry, you're your own. I can't continue again. The rule says you must continue until the victim is handed over to the doctor. You must continue until the victim gets better. You must continue. Of course, when you are tired, do not be a victim. Once you are tired, let somebody else take over from you. So it is in those circumstances that you can decide to stop. Otherwise, you must have that perseverance. Explicit, give precise, detailed information of the victim and the treatment given when calling for help or when handing the victim over to medical crew. You see, here I want to say, we're talking about giving information. The exact location matters. When you are calling for help, for example, you are calling for help, you must mention the location of the emergency. The location of the emergency is very, very important. It's very, very important, because time and information is so important in first aid. Time and information is so important in first aid. So you must know that precise information is required when you are handling a victim. And again, we say you must be careful. You see, somebody some time ago asked me that, why would you be careful when you see that situation is getting out of hand and all that? Please maintain calmness when handling your victim. Your facial expression can tell situations. I want to repeat that. I said your facial expression can tell situations. If your face is not bright at all, and maybe if the victim is conscious and is seeing you in that mood, it means you are telling the victim that his condition is a hopeless one, and that is why you are not happy. Or even if the victim is unresponsive, is unconscious, or perhaps the people around there, they are looking at you and they see that your face is not bright at all, it means you're also telling them that this case is a hopeless case. Always try to put up a cheerful appearance at all times when you are handling your victim. It's so important. It's very important, because so many a time you see, let's assume you just take a visit to the hospital and the victim is in the theater. You are at the doorstep, waiting for the doctor, the nurses to come out of the theater room, and they came out from the theater room with the face squeezed. That's a message. In fact, if you come out in such manner, even since because of anxiety, they can even hold you and strangulate you, because they want to hear what has happened there in the theater. So what I'm trying to say here is that try at all times to be cheerful with your victim, with the people around you when you are attending to any of these situations. Now let us look at the general rules guiding first aiders, because it's so important. These do's and the don'ts, they don't stop at what I have here. They are so numerous. But I have just decided to pick some of them for discussions here today. But your mind will lead you to other do's and other don'ts. For example, in arrival at the scene of any medical emergencies, I say do not panic. Stay calm and take charge. Once you are panicking, I bet you'll get confused. And when you are confused, you start doing the wrong thing at the right time. Even when you know that thing before, because of that situation where you find yourself, you start doing the wrong thing at the right time. Then at the end of the case, at the end of the day, you say, I should have done this, I should have done that, when the case has deteriorated. So please stay calm. That's the first thing. Like I used to remember a case of somebody in those days when we were in a primary school. He cannot withstand the sight of blood. Even went to kill a fowl, it was a big problem for him. But today, that my good friend is a surgeon. You know, do not panic. That's just the message. Stay calm, then take charge. 2, do not expose your victim to further danger. Use common sense. We say use common sense, but how common is that sense? There are situations where we will tell you, the rule says do not do this. But because of where you find yourself, that is where common sense comes in. The rule says don't do this, but you may do it, especially when the rule says don't move the victim from the scene. Generally or globally, you say your victim should be attended to right at the scene there until medical emergencies, handlers, or maybe until experts now come and they take charge. But in this case, in Nigeria here, if somebody is involved in an accident or is on the highway and the rule says do not move in from the scene, what do you think is going to happen? So in such situations, you must move the victim. That's where the common sense, can also come in. 3, do not attempt to do too much if you are unsure of what to do. Know that it may be better not to do anything at all than to do something that will endanger the life of the victim. Let me say clearly here that you must know your limitations, because some persons, they try to overdo, do not take the responsibility of even the doctor. Remember, I said some time ago that you are a first aider. You are not the doctor. Even a medical doctor, when he's not in the consulting room, when he's out of where he will use special equipment and all materials, he is playing the role of a first aider until he gets to where he can use sophisticated equipment or materials. That is where we're all the same. But I must let you know this, that some of us today, you go to part-time nursing stores, you call the attendants, then you call them nurses, you call them their doctor. You see, when you call them these big names, it makes their head become so big, and they do more than what they are supposed to do. I can't imagine you going to meet a part-time nursing store dealer where they do some decisions and so on and so forth, which is not supposed to be their duties. So we must know our limitations. The other time we discussed about the child structure, where we mentioned, your boundaries. So don't forget, you must stick to that boundary as a first aider. Remember, you are only doing something until the victim is handed over to a more professional hands. They will continue from there. So do not overdo. You should know your role. Do not move victim unless absolutely necessary. That is, when the victim is exposed to further dangers in case of fire, drowning, and so on. Here again, we are still talking about that common sense. You see, there are situations where you find that the area is not safe. So you either move the danger from the scene or the victim from the danger. Again, do not allow people to crowd around you. Use others to keep the crowd away. It's so common. This is a case, most time when it happens, outside, especially on the highway and so on. You see people come and crowd around the victim. They constitute nuisance. You can even use as a well-organized first aider. You can even use amongst them there to control the crowd and let them move away, because that victim requires, fresh air. So always know how to make use of the people, especially the crowd.
Mr. Collins.
Do not leave your victim unattended until the doctor takes
Presenter,
charge. People
sir.
have said something about this before.
Presenter,
It's
sir.
not coming in again as one of the dons. So most time,
Mr. Collins, please pay attention.
Must not be left unattended, like I mentioned before.
Mr. Collins, I'm trying to draw attention to the fact that it's already 1:43. So
hello,
we can just round up so that we can take the next slot.
Just make a summary.
Hello.
Yeah.
Summarize your presentation.
Summarize your presentation.
Okay, let me quickly just run down. On the general rules, do not give anything by mouth. It's very, very important. Do not give anything by mouth. At all times, it's very, very important. Giving reassurance and calling for help is very, very important in first aid. And this can be demonstrated by words of the mouth or by your actions. I repeat, in all situations, giving reassurance and calling for help, they are very, very important. And do not lose any tight clothing or restrictive clothing around the neck and the waist to allow easy and blood circulation. Okay? And do take your victim to the hospital. Remember, you are a first aider. Whatever you can do, and take your victim to the hospital or take your victim to the doctor. All I have said here today is that it is good for every one of us to have the knowledge of first aid in our homes, in our places of work. When we have this first aid cover in all our homes and our place of work, it will help to reduce the lives that we may have lost. So today, I am going to register again that to say, we must have in every home, at least in every home, a first aider. It will help us. Thank you very much.
Thank you very much. Let me do the clapping so that I won't have.
Thank you very much.
We appreciate you, sir. I think at this point, let's take the next presentation. Then we'll come back. We can now take some questions. I think that will help us save time. Please note your question. We're going to take it after the next presenter. And the next presenter is going to take us on sudden collapse, fainting, and unconsciousness. Right. That is Mr. Dominic Ehibe. Thank you, sir. You can go ahead.
I'm defended.
Good afternoon, ladies and gentlemen. My name is Dominic Ikegbe, and I'm here to present to you fainting, unconsciousness, and sudden collapse as it is on the program. Thank you. Before then, let's watch this video and see what happened.
I'm defended.
Mr. Dominic, you are not sharing it, so we can't see it. So please, you can reshare it so that we'll see it.
I'm defended.
Are you seeing it now? Can you see the screen now? Can you see the video?
No, we cannot.
I'm defended.
We cannot see the video.
Can you see the video?
No, we cannot see it.
MD fainted though.
Please, can you see the video now?
Oh, sir.
Can you see the video?
No, sir.
Oh, we can't see the video.
We can see your screen, but we can't see the video.
Maybe you have to double click on it and let's see if it will come up.
MD fainted though. MD fainted though.
The video is still not coming up. Maybe you can just go ahead with the lessons we need to learn from that video, so that will save time.
Okay. Can you see the screen now where we stopped last?
Yes.
Okay. Okay, thank you so much. Sudden collapse is something that happened most times, and many people do not know what to do, either because they are not trained first aiders or because they don't know what to do. And because of that one, they don't know how to equally respond. In many cases, we discovered that people who have sudden collapse, when they are not attended to on time and in the proper way, they ended up giving up their lives. And that is why it is very important we understand what those sudden collapse are, what causes them, and how to manage them. And most of the things we call sudden collapse in first aid, we regard to them as unconsciousness, because most of them lead to an unconsciousness. And that is where we are going to be dwelling on. Now, what is unconsciousness? Said unconsciousness is a condition in which there is a depression of the cerebral function. When we talk about the cerebral function, we are talking about the brain, the function of the brain, a condition that leads to the brain why the brain can no longer function the way it's supposed to function. Because as we all know, the brain is what controls the entire body, controls most of the organs, controls every other part of the body apart from the heart, which the brain does not have total control on. So because of that, when people suffer certain ailments and they go into an unconscious state, there's that tendency that the brain is not able to function properly. And when they go into that state of unconsciousness, what now happens is that such victims or persons does not know what is happening to him, and he does not even know where he is. He may not even know how he has gone into that stage. And this stage of unconsciousness may lead from stupor to coma. It is on the stupor stage when somebody is unconscious, he doesn't know what is happening, but yet he is breathing. Yes, he may be making static glimpses, he may be doing all sorts of things, but not knowing that whatever he's doing is not in line with what he's supposed to do. And that is what we call the stupor stage. And that is where many times people have said that somebody drank to stupor, meaning that he has taken a lot of alcohol and started misbehaving, possibly even find himself in a drainage, and yet do not even know that it is the wrong place. That is stupor condition. And it may also be up to the extent where the person will go into coma. Coma stage is a stage where somebody is unconscious, and no matter what you do, even if you prick him, even if you pinch him, no matter what you do to bring the person back, the person will not be able to respond. That is the coma stage. Now, there are so many things that can cause unconsciousness. And in our slide here, we just try to put them in an acronym, which is easy for everyone to memorize. And that is what we call the fish shape. If you look at the left corner of your screen, you'll see the fish shape there. It's an acronym, the word that stands for the causes of unconsciousness. And the first F there stands for fainting. The second one, I, stands for imbalance, body heat, or infant convulsion. The S stands for shock. The H stands for heart attack. The other S stands for stroke. Then the H stands for head injury. The other A stands for asphyxia. Then the P stands for poisoning. The E stands for epilepsy. And the D stands for diabetes. Now, in all the ailments put together, we summarize them into this form, and we acronym it to be fish shape. Now, because of time, we might not be able to look at every other one. But suffice to say that the imbalanced body heat, shock, heart attack, stroke, head injury, asphyxia, poisoning, epilepsy, diabetes, they all lead to unconsciousness, and they all have different type of treatment as far as first aid is concerned. The first aid will tell you the signs and symptoms of it and the best way to handle that situation if you are able to diagnose that, yes, it is as a result of shock or as a result of heart attack or stroke and so on. And it will now tell you how to handle it. That is the best treatment or the best first aid treatment to give to such a casualty. Like as I said, because of time, we are going to take just the first one, which is fainting. Now, what is fainting? Fainting is a brief loss of consciousness of no more than momentary duration, caused by a temporary reduction in the flow of blood to the brain. Recovery is usually rapid and complete. So what we are saying here is that for anyone who faints, is a momentary duration. It does not last long. And even some of them, or some people, or some victims that are fainted, even without being attended to, after some few minutes, you see the person come out of that state. Why? Because it does not last long. It's just a temporary thing. And this may be as a result of reduction in the flow of blood to the brain. That is when the brain is unable to get sufficient oxygen. And we all know that it is the blood that carries this oxygen to the brain. So once the brain is unable to get sufficient oxygen, therefore the tendency for the person to go into fainting is there. It may also begin with a feeling of faintness, or maybe a sudden collapse. It can be nervous reaction to pain or fright or emotional upset, and so on. Hence, the causes of fainting may be shock. It may be as a result of fright. It may be as a result of news of special nature. Maybe you are not expecting anybody to come and give you the news of your loved ones that have passed on, and suddenly, before you know it, the person just dropped the news to you without missing word, and your body system can no longer comprehend it. What happened? You can trip off that momentarily and go into fainting. It could also be as a result of tiredness. Maybe you'll be working all day long without rest. It can lead to fainting. Even hunger. You have not eaten for the past 2 days, and here the body is weak. You no longer can be able to do certain things, and the stomach is empty. Yes, of course, it can make you go into fainting. And of course, exhaustion can also cause it. So many things like that can lead to fainting. Even long period of physical standings, as in parade ground, can also cause it. Even when the atmosphere is warm or very hot, can also cause it. Even for footballers, maybe those that have been playing football, because of the way the exercise is going on, you discover that most of the blood is being collected at the lower part, especially the lower lips, of which it's now difficult for more of the blood to now go to the brain. Of course, that can also make them to fall down and collapse, and they can go into fainting for that. So these are just some of the few things that can cause fainting. And like the videos I was trying to show to you, in fact, I had 2 videos I wanted us to see. One of it was the MD who was being interrogated for certain things he did wrong, and maybe he was not expecting some of the things that he was being told, and before you know it, he started collapsing, and those who were there decided or they were trying to help. And in that video, if you look at it, you discover the poor handling of how those who were there handled the managing director, just because they have no first aid experience. Because they have no experience in first aid, you see them trying to open the teeth, the mouth wide. Maybe possibly they think that by doing that is for the teeth not to clinch together. And here we want to say that clinching of the teeth does not necessarily mean that the person will pass on. So there was wrong handling there, and I do believe that before the end of this particular lecture, we get the best way and the best method of how it can be handled. Now, what are the signs and the symptoms if somebody is going to faint or has gone into fainting? What are the signs? For instance, if the person has actually fainted, if you check the pulse, which we are going to show to you how to feel for your pulse. If you feel the pulse of such a victim, you will discover that the pulse will be very, very slow and it will become weak. Why is it like that? Because the blood vessels is lacking enough of volume. Possibly there is no much fluid that will make you to feel the pulse in a very strong way. So when you feel for that pulse, it's going to be very slow, and it will also be weak, it will not be strong. And the strength of that person, talking about the general capacity or the power of that person, will be highly reduced. There will be no strength in such a casualty. And of course, the casualty can become pale. The casualty can become pale because we are talking about oxygen here. And if the brain is not able to get that oxygen, and there is no more oxygen that the body tissue is getting, or some of the cells can get, therefore the person can go into pale, where you see the person, if the person is a very yellow somebody, you now see the color change, maybe trying to look somehow gray or white, the color will change. And if it's a black person, you now see the person looking in form of a gray color. So definitely the color of the skin of that casualty will not look the way it is now. It will not be shiny. Why? Because there is no more oxygen in the system. And of course, the person can go into an unconscious state. The person can go into an unconsciousness, and that is where you see the person will actually trip down, fall down, and may not know what is happening to him again, except the help of those who are around him. It's only those people that can actually respond to him, and if possible, resuscitate him and bring him back to life. Sometimes for those who are hungry, when there is nothing in the stomach, they may be nausea. That is where they feel like vomiting. The stomach will be turning because there's nothing there. So they feel like vomiting. So there's nausea, and there could be dizziness because of the weakness of the body. The person becomes dizzy. And of course, he may have shallow breathing, and the forehead may be covered with sweat. You just see the forehead or the person sweating profusely. And as a first aider, what is now our duty? Because that is why we are here, to know how to respond to such victims. The first thing that should come into our mind as first aiders should be to increase the blood to the brain, because like as I said, it's a reduction of blood flow to the brain. So the moment you see the person going into fainting, or maybe tells you something that makes you feel that is a sign that the person is going to faint, you quickly and immediately try to help the person to ensure that there is more blood flow to the brain. And if you look at the treatment of fainting, you see the first photograph on the left-hand side top, you see the person sitting on a chair. That is a fainting casualty. In that situation, the person feels fainting has not actually collapsed, but is already feeling the sign. For instance, you are working with a friend and all of a sudden he tells you that I don't know how I'm feeling. It's like the whole place is turning around me. That will tell you that he's already experiencing signs of fainting. And you as his friend or a first aider should be that you should take him to sit in one place and lower his head down so that more of the blood can now flow to the brain. And that is exactly what that first aider is trying to do to the victim by telling him to stretch forth his hand to his foot while he lower the head. And if possible, if the head can touch the nail, then that will be better. That will enable the casualty blood to flow to the brain. Or where it is not possible for you to do this, or you have where you can lie the casualty down, quickly lie that casualty down. You lie the casualty down and you open the airway. Lie the casualty down and open the airway. It is very, very important. And when you lie the casualty down, you try as much as possible to support the lower limbs. Support the lower limbs with materials or a wooden chair or whatever to a height of about 12 inches. You are doing this to enable you to allow much blood to flow back to the brain. More especially when if it is somebody that you feel because of his long standing or maybe because of the way he has been, maybe most of the blood are collected on the lower limb. You do that immediately so that the blood can now flow back to the brain. Because at this time, the lip does not need much blood. People can survive without lips. We have seen it. People survive without lips, but nobody will survive when there is brain damage. Nobody can survive when the brain has packed up. So, or when the heart can no longer function properly. So Raising the legs above 12 inches will enable more of the blood to flow back to the heart and the brain so that the heart can get enough of the blood to circulate around the body, and the brain can also get it to use so that most of the other tissues and organs can also get it. And you do that as you also give the person, you fan the person, give him more air or oxygen. Try to fan the person. Don't pour water on the casualty like what we saw or what is on that video that I would have showed us in the MD's clip, where one of the persons standing by just took a bottle of water and was pouring some part of it on the MD's head. It is wrong treatment. Don't pour water on somebody that has fainted. If you do that, you can complicate the situation. So what the person needs is air. The person needs more of oxygen because the person needs more of the oxygen for the blood to take in and circulate around, so that even the cells, the brain cells, can be able to revive immediately. So that is what you do. You don't pour water on the casualty. And of course, always remember to reassure your casualty. Reassure your casualty at all times. It will be well with you. Don't worry, you are okay, you will be okay. And like we said, it does not take time. It's just for a moment. If somebody fainted, it's just for a moment. So within a few minutes, the person may come out of that situation. And if he comes out of the situation, then you give him reassurance. Reassurance that is trying to encourage the person the more, and try to see how you can tell the person good things that will make his heart to calm down, so that he will not feel as if the situation that he has just faced is a very serious one. So you give the person words of encouragement, you give the person reassurance, and you monitor the person too. You monitor his situation, and that is what that person that is trying to feed the carotid pulse is trying to do, to see whether the pulse have now become strong, because once they come out of that state, like we said, it may be complete. It may be complete that the person may not even need to go to the hospital, especially if it's as a result of bad news or whatever, except where the situation is more difficult than that. Then, otherwise, in most cases, they come out of that situation without any much modification or treatment. So that is what you do. You monitor the casualty, and if it's as a result of hunger, if the person comes out of that situation and it's as a result of hunger, and the person is not conscious, meaning that he's conscious to, he can talk to you. If you ask questions, this casualty can be able to tell you, yes, this is the situation. Or yes, I was hungry, I've not eaten since yesterday. And even this, up to this time we are talking, I've not eaten anything. That is why I didn't know what happened to me. I suddenly found myself on the ground. Then you now know that the person is not conscious. In that situation, you can give the person fluid, first of all, to take in. Give the person fluid. So something like water or any beverages that is not alcohol, you can give to the person so that the person can use it to regain energy before you now start introducing other food items or solid food. So that is that. So fainting is very easy to treat as a first aider. So we shouldn't just run around when we see them. We try as much as possible to ensure that we treat them. So if anyone faints or is about to faint and he tells you of these signs of fainting or how he's feeling, and you now feel that yes, that is a sign of fainting, then start to treat the person immediately so that it does not collapse on your hand. And also, if the person now fall down or collapse, you check for signs of life and you discover that yes, the person is breathing. You check and you know that yes, there is circulation. Therefore, you just need to raise the person's leg 12 inches above the ground level, and that will just help the person to come out of that situation immediately and on time. Thank you so much. That is the end of the lectures, please. Any question?
Thank you very much, Mr. Dominic.
Thank you very much. Thank you very much. A good one.
Yeah, very timely. So please, if you have any question, let's have your hand up so that we can recognize you. We have between now and the remaining minutes to take question.
Yeah, Secretary, I think you coordinate the
question,
question.
please.
Thereafter, we'll see if they can take another section before we go for break.
Okay. So you have a question, please?
Depending on the question and answer section. Thank you.
Okay.
Question, please.
Go ahead.
All right.
My name is Edward. I want to ask, how can you apply air into somebody that has fainted? The picture shows us that he's putting something that like a fan. Is that the only way to apply air to somebody that has fainted? Thank you.
Well, we will go into resuscitation shortly, and in that resuscitation, we are going to tell you how to give artificial air to somebody or a victim that has suddenly gone into an unconscious state, and you will be told of that. So that one you see is just to give the person air. That is fanning the person to give him air so that he can take in enough of air. So that is what is there. It's not a first aider administering ventilation into the lungs of the casualty. Thank you.
Okay, thank you. Any other person, please? So if there's none, which means the facilitators have done justice to all the presentations so far.
I have a question.
Okay, who can you introduce yourself? But it will help us if you can indicate so that we'll follow it in sequence. But I guess it's Kingsley that want to take the next.
Yes.
Is that Kingsley? Okay, go ahead, please.
Yes, good afternoon, everybody. Thank you very much for this wonderful presentation. I was wondering if somebody, okay, for instance, I have been in a situation where a hawker was carrying what she was carrying on her hand during the rainy season, and one electric wire just fell ahead of the person, and the person just stepped into water that's connected with the wire, and the girl stood like stiff and like she didn't know herself. She couldn't even. Eventually, somebody hit her, and then she fell down. Now, my question is, we are talking about shock, or we are talking about unconsciousness. What if it's arising from electric shock? How does one get into that?
Well, like as I said earlier, that so many things can lead to an unconsciousness. And what you have just mentioned now is one of the causes too. When it comes to electrocution, we look at it under shock properly. Shock is not part of our conversation this afternoon. Ordinarily, like you have said, if such a thing happened, which means the tendency of the person to fall down is there. So as a first aider, all you need to do, if the place is safe, don't forget we have talked about safety and security. Maybe Chief Collins is going to mention that again. If it is safe for you to assess, then you assess the condition in which the person is and now give the appropriate treatment in first aid. Like in shock also have similar treatment like that of fainting. It's the same process, it's the same procedure where you have to raise the person's leg up. So that is the same treatment you give to a casualty that is into shock. So if it is a shock, like you ask, you discover that for shock, like as I said, so many things can lead to it. We have the one that has to do with hypovolemic shock, which is a reduction of blood flow volume in the body. You have the one maybe of a heart attack. Maybe the person is having heart attack for a very long time. We have the one of prolonged ailment, okay, these are conditions that can lead to shock. But in all of them, all you need to do is to ensure that you are able to treat the casualty. Like as I said, the treatment of shock and that of fainting is the same, which is to lie the person down, raise the legs up 12 inches above the ground level.
Okay, thank you, sir. Any other person? Okay, if there is none, let's quickly take the next presenter. We're having Mr. Collins back on recovery position and CPR. He's going to take us from now to 3. After his presentation, we'll take a 1-hour break from 3 to 4, come back, and then conclude the session from 4 to 5. Thank you. So, Mr. Collins, over to you.
All right, good afternoon once again. I am back to discuss with you, but before I go on, the question that was asked, I want to throw just a little light on it, talking about the shock. Because all will boil down, the end result will boil down to resuscitation. And when you have shock, fainting, and unconsciousness, you should know that unconsciousness is more severe than the remaining two, shock and fainting. But it will be good for us to know the management. And that will take me straight down to the topic now, managing resuscitation. Now you have just been told about unconsciousness. Unconsciousness, again, I want to let you know, is a great threat to life. In most cases of medical emergencies, the word is always there. And when I got there, the person was unconscious. We use this word all the time. But I want to let you know that the moment you pronounce that somebody is unconscious, there's a great threat to life. And what is that threat? The first thing you think about is obstruction of the airway, which of course can be caused by the tongue. So you find that most unconscious victims being handled by the would-be rescuers, they will not know the dangers facing such persons. All they want to do is that they want to save the life by just rushing the person to the hospital, even when the airway is closed. However, in the management, we want to say, following that principle, in as much as we have said earlier, that saving life is everybody's responsibility, your own life is also important. So you must check the danger as you are approaching the victim. Let us assume that somebody has just collapsed and you are not going to do something. We have said the security and safety of the victim and the people around you there is important. How would you conclude that this person is actually responsive or not? My colleague was trying to show a clip, though it was not possible for us to get it on to the view of every one of us here. Of course, that's something I know so many of us may have seen in social media before, you know. But in checking for responsiveness, there's a common code we use, and that is the ABPU. When you arrive at the scene, is the victim alert? A is for what? Is for alert. Can he respond to voice? V is for voice. Can he respond to pain when you prick on him? P is for what? Is for pain. In all, is it all responsive? Now, this question here will drive you to your actions. If you do this and find that the victim is responsive, in other words, if we go back to the aims of first aid, which says to save or to preserve life, number one, to preserve the condition of the, to reduce the condition for getting worse, number 2, and to promote recovery. So when you are checking for responsiveness, for instance, and you find that the victim is unresponsive, you know you have a lot to do in that situation, in that case. But a situation where you check and the victim can respond, it means there's no immediate threat to life, but there could be some other injuries which you are going to care for. But in that case, there is no immediate threat to his life. So the AVPU as a code, I want to say that we should always register this in our heart and in our mind at any time we see of medical emergency, because it can drive you into your actions, the actions you are going to take. If, for example, the victim is unresponsive, there are 3 words we are going to take, we are going to follow. And these 3 words, they are, one is C, circulation, A for airway, and then the last one is B for what? For breathing. Are the 3 words. C for circulation, A for airway, and B for breathing. So if you check and your victim is unresponsive, we say, please go and check the pulse. Checking the pulse, you will agree with me that most time the medical doctor will want to use the radial pulse, the temporal pulse, in checking to see if there is circulation or not. But I will tell you this, in the actual sense, you as a first aider, the best you can actually use is that of the carotid. Because the carotid, you can see, you can feel the pulse rate there is higher. Even when the heart is weak, you can also feel it there. But when the heart is filled, if the heart is weak, you as a first aider, you might not be able to feel the radial pulse. But the medical professional can feel it. And that is why we always want you, to use the carotid pulse if you have to. Okay? And I'm sure you know where that is located, the carotid pulse. It's slightly, if you are seeing me here, just by the side, okay, let me use the common word, the side of the Adam's apple, your hand force slightly right there, okay? That is where you can get that carotid pulse, all right? I'm sure you can see from the screen where you can feel that pulse, all right? I'm showing here from the radial and then the carotid pulse, where you can always feel it. Now, so you feel the pulse, that tells you the blood is in circulation. At that point in time, we will say, since you feel the pulse, and of course, the victim is, when you feel the pulse, it means the victim is breathing. I mean, it means, yeah, of course, it means the victim is breathing. You have to place the victim in what? In the recovery position. Especially when you check and you find that it's breathing, you place the victim in the recovery. I'm going to do, I told you some time ago that you there, wherever you are there, get a mat, get a blanket. If you don't have a mat, a blanket, or maybe even your rug, and let somebody be there to stand as or to act as a victim. We are going to do this demonstration together here. Wherever you are, please just be organizing yourself now. We'll come to that. We'll come to that stage where we all do this demonstration together, wherever you are. All right? So if the victim is not breathing and the response will say, of course, give artificial respiration for every 4 to 6 seconds. But I want to say this. You will have heard the word AED, automated external defibrillator. Yes, CPR can be done. And when you are doing CPR, you are doing it to buy time until the arrival of an AED. I want to remember some good years ago, before 2005, the word AED was not common here. It was not common here in Nigeria. It's only in some hospitals that is where you can talk about the use of an AED. Even few hospitals. But as with our time goes on, after a series of updates and all that, we come to realize that when an AED is closer to you, more lives could be saved than when there's no AED. So we are going to do a very common thing that we're going to do here today is that of the recovery, which is very, very important. It's a position you place a victim before the arrival of medical professionals or before the arrival of whoever will help or will come to help in that situation. We are going to demonstrate that, and we all know how to, before you evacuate your victim to the hospital, you must know how to do it. Now, if you have the mat there, spread your mat on the floor or a blanket on the floor. If you don't have a blanket, maybe you have a rug. Do that. So what I want you to do now is this. Now, we are going to read through this first, and I will come back to it because you are going to demonstrate along with me. First, you are going to check for danger. 2, you check for response. 3, you reassure your victim. 4, you're going to tip the head back. Then leave the chin up. When that is done, place your ear at the nose of the victim while your eyes is looking at the chest of the victim. You look, listen, and feel for breathing. Our victim is breathing, of course. Place the arm nearest to you in a right angle. You're going to bring the farthest arm across the chest and place on casualty's cheek. Then leave the farthest knee up until the foot is flat on the floor. You're going to put the casualty onto their side. Now the victim is in the correct position. Then bring the knee at the right angle. Open the airway. Check for breathing. And then you now go and do secondary survey. Secondary survey is you are not going to check if there are other injuries. Then you make your phone calls. You are not going to monitor the victim until help comes your way. Now, we will go through this. I want to know from you now if you are ready with the blankets and then the mats. Are we ready? Yes, I'm sure I can see a family now getting ready. Yes. If we are ready now, can somebody now lie down, face up? Somebody lie down, face up. Is somebody lie down, face up? Yes, of course. Now, if we want to assume that the person that is lying down, face up now, that person suddenly collapsed. We want to believe that. Okay? Okay, move away. Move away some slight distance from that person lying down. Move away. So you will not be coming close to the victim and checking for danger. Okay, I want to assume there's no danger. You will not be checking for response. And when you are checking for response, what do? You start asking, hello, hello, are you okay? Can you hear me? What is happening? Right? Now, don't forget, we have mentioned some time ago that you should reassure. The assurance comes in all the time. Okay, there's no particular place where you have to reassure. Now you are with the victim, and we say it is clear. Now tilt the head of the victim back. Have you done that? Okay, now that you have done that, lift the chin up. Have you done that? Okay, I can see a family doing it, right? Since the chin has been lifted up, place your ear at the nose of the victim with your face. looking at the chest of the victim. Are we doing that? Now you look, listen. Are you feeling air? Can you feel the air? Oh, I can see one family doing it right. Yes, I can see that family doing it well. Are you feeling any breath? Okay, you're feeling the breath. That's good. That's good. Now, place the arm nearest to you in a right angle. Are you doing that? Place the arm nearest to you in a right angle. Are you doing that? Oh, beautiful, beautiful. Now, bring the father's arm across the chest and place on the casualty's cheek. No, I said, bring the father's arm across the chest and place on the casualty's cheek. Okay, you have done that, fine. Now, lift the father's knee up. Lift it up until the foot is flat on the floor. Until the foot is flat on the floor. No, that's not what I said. I said, lift the father's knee up. Yes, I'm doing it now. Until the foot is flat on the floor. Until the foot is flat on the floor. That's good, that's good, that's good. Okay, you cannot put the casualty onto their side. You cannot put the casualty on their side. Yes? Yes, I am proud. No, you are doing it wrong, you are doing it wrong. You are doing it wrong. I said, put casualty onto their side. Then bring the knee at a right angle. Then open the airway now. Open the airway. You cannot check for breathing. Oh, the breathing is in a record position now. Do a secondary survey. When I say do a secondary survey like this, you are going to do a head to toe, check if there are other injuries. These other injuries, they are not as important as when that victim is found to be unconscious. So you cannot check if there are injuries at all from another part of the body. You cannot make a call. Make a call. Call the medicals. Call the medicals, and you will continue to monitor this victim now. I'd like to repeat this again. I'd like to repeat this again because it's so important that we know it very well. I can see one family doing it. I can see one family doing it. Oh, look at these people that just sit there. You're not doing anything. Oh, no. Let's do it again. We're going to do it again. Are you following me? Yes, are you following me? Okay, let's do it again. Let's do it again. First, I'm going to take it gently now because I want us to do it. I want us to do it well. First, let somebody lie on the floor. Is the person there lying now? A lie face up. Is it lying face up? Good. Now move some distance away, as if you are just coming to witness somebody who just suddenly collapsed. So as you are not coming in, check to see if there is danger or not. Okay? Remember we said, if there is danger, it is good we lose one person down to lost two. Check for danger. Your life is important. Okay, there's no danger. Now that you are getting close to the victim, check for responsiveness. How do you check? Start to ask questions. Call. Hello, are you okay? What is happening? What is happening to you? You know, when you are asking, you expect response for the victim. And that was why I gave you that code, AVPU. AVPU will help you. A stands for alert. Have you forgotten? V stands for voice. P stands for pain. And U stands for unresponsiveness. Yes, you got it. You got it. Now we have checked for responsiveness. In this case, because we will place the victim in the current position, the victim is unresponsive. Reassurance you are seeing there can come anytime, anywhere in this sequence. Okay, you cannot tilt the head up or tilt it back. Tilt it back. Tilt the head back. Have you done that? Yes. Lift the chin up now. You see, if the head is not tilted back, you cannot easily achieve the purpose of lifting the chin up. So lift the chin up. Good. Now the airway is open now. Remember I told you that when somebody is unresponsive, unconscious. The threat to his life is the tongue falling back and blocking the airway. Okay? So with this, we tilt the head back and lift the chin up now, the airway is open. Now that the airway is open, place your ear at the nose. Place your ear at the nose of the victim. Are you doing that? Okay. If your ear is at the nose, your eyes will be looking at the chest to see the rise and fall. Your ear, with your ear, you will hear the breath, the sound of the breath. So look, listen, and feel. These three things go together. Look, listen, and feel for breathing. Okay, in this case, the victim is unresponsive. But has a breath. Okay? Place arm nearer to you in a right angle. Have you done that? Good. Then bring the farthest arm. You know when the victim is lying down, the hand that is far from your side, bring it, the farthest arm across the chest of the victim and place on the casualty's cheek. Yeah, you've done that. Yes, you've done that. Yes, I can see somebody there doing it well. Then lift the farthest knee. Now you can lift the farthest knee up. Lift it up, lift it. No, I said lift it up, lift it up, lift it up until the foot is flat on the floor. Is the foot flat on the floor? Okay, yes, I can see somebody there from that far end. Yes. Is that person Maiduguri, or where is that person? I can see you there. Are you in Maiduguri, or where are you? Okay, you are doing it well. I can see you there. I can see you there. Okay, now put the casualty onto their side. Put the casualty onto their side. Have you done that? Yes, you are pulled. Then bring the knee, that knee at a right angle. Bring the knee at a right angle. Yes, you've done that. Have you done that? Yes, you've done that. Okay. Now the victim is lying on his side. Okay. But sometimes the airway could be closed. So you cannot go back again and open the airway. Go back again and open the airway while the victim is lying on his side. Bend down and check for breathing and ensure he's still breathing. Because sometimes the moment you turn the victim, you may find that the victim is not breathing. Because if it's not breathing, you have to turn him again and start. So you cannot do a secondary survey. You can phone on or call for help. Then continue to monitor your victim. Continue to monitor your victim. I know before somebody will ask a question, I'm sure you have done that already. So I want to say that you can know how to place somebody in a recovery position in these sequences I've given to you. Yes, yes, you can do it. After today, I will appreciate if you can be practicing this position using this sequence. Okay? It's so important. Even at the scene, this is what you can do until medical care arrives, that you place this victim in the recovery position. You have done something great. I want to let you know, if somebody is unconscious and is lying face up, the airway is closed. Remember I told you that the threat to an unconscious person is obstruction of the airway, which can be caused by the tongue. The tongue is always there. So do not leave somebody that's unconscious lying face up. Before you know it, such a person could give up because the airway is obstructed by that position. So always know that you place your victim in a recovery position. Now, I am sure you are seeing your screen, the process we have just gone to, and that's what I are saying there. This position, to be sincere, will help the person to breathe by keeping the jaw and the tongue forward and allows fluids to drain out. Okay? There's 3 letters I would love you, if you have a pen there, you may just put it down. JMC. And this JMC, of course, they are well explained here. JMC, the jaw forward, J means jaw forward. And when the jaw is forward, the airway is open. The mouth lowered. When the mouth is lowered, it will help to drain saliva out of the victim if there is any. C, chest off the ground. This will help to ease the breathing. So this is the purpose of the recording position. And of course, the legs position at the right angle, it helps to keep stability. The victim cannot easily roll. So when you place your victim in this position, the victim is relaxed until medical help comes. It's just like sometimes you go to bed, after a hard day's job, you go to bed, nobody tells you. You just roll, at last you find yourself in a position similar to what we have just demonstrated. You're going to have a very sound sleep. Our mothers, if you think back, if they want baby to sleep, they try to place the baby to lie on their side. Okay? Shortly the baby will sleep off. It's a very good position for somebody who is unresponsive and has a breath until medical comes and then take over. Now, supposing you use that code, AVPU, to check the responsiveness of this victim. And when you check, you discover that the victim is unresponsive. After checking the pulse, you find that the victim is unresponsive and has no pulse. Then you have much work to do. And what is that work? You have to start CPR. CPR is cardiopulmonary resuscitation. Cardiopulmonary resuscitation. I am saying that this is a situation where the victim is unresponsive and has no pulse. Don't assume, like the question somebody asked some time ago when my colleague just had his own presentation. Somebody's fainted. You don't need to do all this. It's just because we don't know the differences between unconsciousness and fainting and all that. And that's why somebody just collapsed. Before you go there, you want to put air on the victim. You can only blow air when the victim is not breathing. You can only do compression when the pulse is not felt. So when you check using that code AVPU and the victim is unresponsive, you have job to do. After calling for help immediately, you are going to start resuscitation. These three words, cardio, the word cardio is for the heart. Pulmonary is for the lungs. Then the general word resuscitation needs to revive or to restart. So it's a combination of external chest compression and artificial respiration. And where you want to carry out CPR, it goes with this ratio. You are going to compress the heart 30 times and blow air in 2 times at a depth of 5 centimeters or 2 inches. And when you have 2 rescuers, it's the same as above. But if you need to do this for a child, it's still 30 chest compressions and 2 breaths. And when you are doing it for infants, it's the same 30 and 2 breaths. But what I want to say here, the difference is when you are doing it for adults, infants, and children, adults, children, and infants. The only difference you can see here is if you are opening the airway of an adult, you open the airway maximally. And if you're opening the airway of a child, you do it moderate. And for an infant, minimal. And if you want to blow air for an adult, for example, you want to blow air for an adult, you are going to blow using a full puff of air. For children, it's still moderate. And For infants, it's just the puff of air. But you see, if you want to do your compressions for adults, you're going to use the heel of your two hands, kneel by the chest of the victim, and compress. The heel of your two hands put together, the heels of your two hands, and let's pump. And then you compress. But if you are doing it for a child, the heel of one hand. You're going to use the heel of one hand for a child. And if you are doing it for an infant, you'll be using your two fingers for an infant. So this is what, in fact, at any time we have opportunity of coming together to do a class presentation, we will have the opportunity of everybody demonstrating whatever we want them to do practically. Remember, we said something some time ago that train hands. You will not be at the scene of a scene where somebody needs CPR, then you'll be detecting. Victim, you need CPR, and you will go there and make use of your hand. And that is why a class section will become very, very necessary. Where, for example, in the CPR, there are dummies that can be used for such practice. Not people using a normal human being, you know. So maybe we'll graduate to that. Now, like I've just like what we did some time ago when we were trying to check the pulse, because that's the only thing that will determine whether the person actually needs CPR or does not need CPR, or whether the person needs to be placed in the recovery position or will not be placed in the recovery. It is when you have used that code I have given you the other time. So in other words, anytime you arrive at the scene of any medical emergencies, and then you check for responsiveness and you found that the victim needs to be placed in the correct position, you know how to do it. And of course, you feel that the victim needs CPR, then you should know how to do it. So I think at this point, I will want to pause. And if there are questions, then you will you ask. There are supposed to be questions anyway. There are supposed to be questions. So I will hope to get your questions. Thank you very much.
Okay, thank you, Mr. Collins. The floor is open for question and answers. So if you have, let's have your hand up so that I'll give you the chance to come on board.
So can I ask a question?
Please do.
All right. Maybe two small questions. Number one, in the first instance, when...
Please identify yourself.
Okay, my name is Kingsley Okehelen. I'm a member of this organization. And I'm with my family. My first question is, you know, for some of us who know a little bit of it, when there is fire, you must have an equipment with which to put out the fire, which is fire extinguisher. A mention was made of AED. My question now is, in some families, we don't have all those high-end equipment, AED. Assuming they are saying anything, what you're saying is that we must do like mouth to mouth and all that to resuscitate a person, something. Then that's number one. What is the alternative to AED? You don't have it in the office. Number two, this must be, maybe you are going to answer it later, given the present situation of pandemic in the whole world, and we are not sure somebody has COVID-19 and so on. How do you battle with that? If you want to really sustain the person, giving the person. Yeah.
Are you through the questions? Hello? Are you through the questions?
Yes, you heard me, sir. You heard me?
All right, I heard it well. Now, number one, I did mention that the use of AED came fully in practice in Nigeria here. Let me just say from 2005, that before then, you can only have access to AED in the hospitals, or good hospitals anyway. And they want to say it's only the cardiologists that can apply AED and all that. But before, after then, from Resuscitation Council, they made it that AED need to be simplified, so that the first aiders or health providers can have access to it and then use it, because from the past they found that most deaths was as a result of not getting AED early enough. However, as a layman, as a layperson, like somebody like you said, you are with your family, I'm happy to hear that your family is with you there. You might not procure an AED at home, but what is important is that if you, I did mention too that you do CPR to buy time until the use of an AED. So if you have a case, for instance, somebody collapsed at home and you have a system where you have such cases, you call your doctor. So while your doctor is on his way coming, or while you are taking him to the hospital, you are doing your CPR. I remember I told you that you are doing CPR to buy time until the arrival of an AED. So even if you can have an idea of how to do CPR within your household, I think you have done a lot to save life. Leave the remaining aspect of the AED to the medical professionals, but do the best you can within your household by ensuring that you can do CPR, until everything gets to the hands of a medical doctor. Then the next question there, you're talking about with this present situation we are in the world, not this country only, talking about COVID-19. Okay? Yes, I want to let you know, COVID, apart from maybe COVID, some time ago, HIV, and then what's the other? Ebola and all those stuff. These are dangers to us. I will say, if you must save somebody's life, you must consider all this as what as a danger. Ask yourself, is this safe for me? Because the truth of the matter is that even when I know I am safe, you may not know if I am safe. All right? If I'm a COVID-19 carrier, you will not know that I have COVID-19. So in other words, if you must attend to business, especially in a crowded place and all that, also put in mind that there's a COVID-19, and in such a way you should abide or go with the COVID-19 principles. So what are we talking about? You must have barriers. Okay, you must have barriers. I did mention before that these things, they are more when you have a practical class. I will be able to explain to you the type of barriers we can use. But the capital word I want to leave with you here is that we are going to do all these things with due regard to COVID-19 principles or training principles. Kinsler, are you there?
Thank you, sir.
Yeah, thank you very much, sir.
Yeah.
Yeah, Kingsley, thank you for the question. Akin Boboy, do you still have a question?
Okay. Can you hear me?
I can hear you.
Yes,
clear.
go ahead.
Okay. The name is Rotimi Akin Boboy. I'm a member. I think the question I wanted to ask has already been asked by the previous person. It's concerning the artificial respiration, the resuscitation using a mouth-to-mouth kiss, or what we call kiss of life. I just wanted to ask if there is any alternative, because already we know that there's a lot of pandemic out there, and that thing has really opened our eyes to even the ones we've not been scared of before, which is tuberculosis. A lot of awareness on that you can easily contract it, and you may live with it for a very long period of time, and you may not even know. So I just wanted to ask if there is any alternative to this kiss of life thing. Is there any other way we can do it? Can we also use this? Can we also use this external chest compression as an alternative to artificial respiration?
Thank you very much. You can continue to do just compression while making contact with your medical professionals until the video is handed over. So continue compressions.
Oh, thank you very much. That is just what I want to confirm. Thank you very much.
But while doing that, I said, do not forget the COVID-19 guidelines. Okay.
Okay, sir.
Yeah. Okay. So, but the right answer there is you just continue. Just continue your chest compression, because when you are compressing the chest, you are driving blood from the heart to all parts of the body. But how soon you get to the hospital matters. You are not going to keep your victim in one place and they say, colleagues at the right time say we should do compressions, and you will be doing it without making a call to medical professionals who will take over. Remember, you are bridging the gap between the moment it happens and when medical will take charge. All right. So I would like to ask this question, please. I would like to ask this question. Did any of us follow the practical section of it, especially the recovery position? Did any family did that at all?
Yes, I did. Good afternoon, sir.
Yes, sir.
Yes, we did. We did. It's a simple thing.
Did, sir.
Because I saw a family doing it, right? Okay?
Yes, sir.
So I'm happy to hear that, because you never can tell that I may be the victim one of these days, and I may need to be placed in the recovery position. I will want you to place me properly in the recovery positions. Yes? Any other question?
Okay, there is no hands up now. Thank you very much, sir. We're just at 2:59 this time. We will be going on break. We have a few announcements to make. If you are interested in getting certificate for this training, you need to make it up with us till the end, which means when we return back by 4, stay with us till 5, and then the facilitators have they are certified to give certificates. So you'll get more information when we come back on that. The 2 more sessions we'll be having is on basic life support and management of choking in adults and children. And the second one will be cuts, bruises, bleeding, and gums. So that is what we are going to take when we come back from 4 to 5. Thank you for the time you spent with us thus far. So we expect that you come back for us to conclude the session. So, President, do you have anything to add?
Thank you, Secretary, for moderating us very well. I would want to appreciate a few people that are here now, because I don't know if they will be able to meet us in the other section. I have my boss in the house, Dr. Silas Agaja. I want to thank you, sir, for joining us in this section. We have a lot of our managers, supervisors, a lot of our ASSP members turn up. I also have my classmates from the secondary school I shared in the group chat. I have our coordinator here and every other person. I have our students with us as well, other guests from global region. Initially, I saw our coordinator, our vice president, and he was here with us in our Miss for Region 9. I want to thank him for being part of this training. Thank you all once more. Just as the president has said, we'll have a 1-hour break and then we'll be back for 4 o'clock for the other section. We hope to see you at that section. Take a break, have your lunch and refresh while we'll see you next. Thank you and God bless. Moderator, what do you want us to do? You want us to close it up or we'll just leave it idle?
No, for me, I'm going to be open till we come back. So you can just scroll down to the beginning of the slide so that the flyers can be on display. But for those who want to remain, no problem.
Okay. 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 So our facilitators, just take it off to the beginning of the slide. Yes. Thank you, sir.
Thank you very much. I don't see anything again.
Check for danger before approaching a casualty. Find out if they are conscious by gently shaking their shoulders and speaking to them. If they don't respond, check whether they're breathing normally. Open their airway by putting one hand on their forehead and gently
MD fainted though.
Wait for me.
我求求你了，行不行？有些事咱回去再说，行不行？
爸爸。
好好，都听你的还不行吗？咱俩之间至于吗？有些事，哎呦，好了，我知道了，我都明白，现在我都明白，你就别说了，行不行？啊，咱俩能不能不说了啊？我一会儿回去见面，咱俩说还不行吗？七哥啊，咋回来了？到今天吗？复原了，复原2天了。有时间同志得去，同学聚会吧。我结婚了，孩子多大？孩子。哎呦我的妈，这不出事了吗？哎，哥们儿来，快，孩子锁车里了，快点帮下忙来。出事了，我这咋的了这是？
Alright, listen up. What to do if you or someone starts choking. Now, I want you to pay close attention to everything we're about to show you, so that you'll know exactly what to do in all kinds of choking emergencies. And you're going to want to share this with your friends, so they might be able to help you in case you're choking. Oh, and don't forget to subscribe to our channel and turn on post notifications to keep up with all our important updates. Alright, number 1. Assess the situation. So first of all, determine if the airway obstruction is partial or total. This will allow you to figure out what you should do to help. If the choking person can still speak, cough, or cry out, it means the airway obstruction is partial. The person can still breathe, but might get pale because breathing is obviously restricted. When the airway obstruction is total, the person won't be able to respond to you, cough, or breathe. The victim will also likely grab at their throat, and their fingernails and lips might start turning blue. This is all caused by the complete lack of oxygen. Number 2. Encourage them to cough.
MD fainted though. MD fainted though. MD fainted though.
Check for danger before approaching a casualty. Find out if they are conscious by gently shaking their shoulders and speaking to them. If they don't respond, check whether they're breathing normally. Open their airway by putting one hand on their forehead and gently tilting their head back. Lift the chin by placing 2 fingers on the point, taking care not to put any pressure on their neck.
Hello, we can't see the video. So
I think I'll need to stop it and
No police light for you.
okay, I want to welcome our participant back to the training. While we are waiting to watch a video before we start properly, just let us know if you have any concern that we need to address before we go ahead.
Check for danger before approaching a casualty. Find out if they are conscious by gently shaking their shoulders and speaking to them. If they don't respond, check whether they're breathing normally. Open their airway by putting one hand on their forehead and gently tilting their head back. Lift the chin by placing 2 fingers on the point, taking care not to put any pressure on their neck, which could block their airway. Look for movement of their chest, Feel for breath on your cheek
Sorry,
and listen for sounds of breathing.
we still can't
If
see
they
the
are
video.
breathing,
It's only audio we
the
have here.
recovery position. First, put the arm closest to you at a right angle. Take their other arm and place the back of their
Can we go ahead, please? The next speaker is ready, so that I can introduce him. The next speaker is Mr. Abamukoro Awerute. He's going to be taking us on basic life support and management of choking in adults and children. So he has from now to 4:30. So Mr. Abamukoro, are you ready?
Okay, good afternoon. Hello.
Good afternoon, sir. We can hear you. Go ahead, sir.
Yes, good afternoon. My name is Aberute Agbamukoro. I'm one of the facilitators. I want to sincerely thank the American Society of Safety Professionals, Nigeria chapter. I want to also thank the president for giving me this opportunity to talk to these esteemed professionals. And with the topic there, it said basic life supports and management and shocking.
Secretary, are you seeing that? Are you seeing this slide?
No, the slide is not on yet, so he will need to display it.
It's okay. I think you. You just hold it. Are you seeing it, sir?
Yes, the slide is up, so you can just put it on slideshow, so that it will be more legible.
Yeah, I think it's on slideshow.
Okay. Okay, let's continue. Like as I said, the basic life support tends to
a set of basic life-saving skills that you can use to help an individual.
It's not still showing. Is it showing?
It's just the slide showing is just indicating choking. So you can maybe scroll down to the next slide.
Yeah, but you're seeing the slide indicating choking.
Yes, it's indicating choking.
Yeah, no problem. Yeah, he will continue. Did you see the next slide now? Did you see the next slide? Types of choking.
No. Maybe audience, can you say it, please?
No.
Okay. So you need to just scroll down and put it on slideshow.
It's on slideshow. Is it showing that one? Check. Please. You tell me what you're seeing.
Okay, hold on. Let me try to share the presentation from my end.
No quick on from this joking. Not the opening up. Opening up is not the problem. Even if you open it up. It is show for your screen, not the show for them. Go check out.
Go check. Okay, let me see this one.
If it is here, no problem.
Can we all see my screen?
Yeah.
That's fine.
Okay, thank you. So, presenter, you can go ahead. Presenter, unmute yourself and let's hear you, please.
Sorry for any inconveniences. Right on.
Hello. Please, oh, sorry for the inconveniences. Can you hear me now? Hello.
Yes, we can hear
Yes,
you.
we can hear you. We can hear you.
Okay.
Go ahead.
Okay. So like I was saying, I said basic life support is a set of basic life saving skill that is used to save life of individual when sustaining injury or is in a life-threatening condition. Now the question now is, what are those basic conditions that one can fall into? And that is choking. The question now is, what is choking? Choking is a common breathing emergency, and another name for choking is airway obstruction. It occurs when the person's airway is partially or completely blocked. What is blocking it? Food particles, fluid, foreign objects can block it. And so if a person is choking, he loses consciousness. There are two basic types of choking, namely partial airway obstruction and complete airway obstruction. In a partial airway obstruction, the individual can cough, he can talk, and he can breathe partially, but his breathing is not complete. While in the complete airway obstruction, the individual airway is totally blocked, so he's unable to speak, breathe, or cough. In this situation, if help does not arrive quickly, the person may lose consciousness. Now, what can cause choking? One of the causes is that trying to swallow large pieces of poorly chewed food, like you put a piece of meat into your mouth and you do not chew it properly and you swallow it, it may not go down into the food canal and it may block the airway. Another thing that can cause airway obstruction in adults, so to speak, is drinking alcohol during meal. Taking food with alcohol during meal, it can cause airway obstruction. How can it cause an airway obstruction? Because when you are drinking the alcohol, it will weaken the swallowing muscles. Muscles responsible for swallowing will be weakened. And so when you put a piece of meat in your mouth, you will not be able to swallow it after chewing. And so that can lead to that. Then wearing of detention or false teeth, that can also lead to choking in adults. Another thing that can lead to choking is eating while talking, or you are even laughing and you are eating, or you are eating too fast. This can lead to airway obstruction. Walking, playing, and running with food or objects in the mouth can also lead to airway obstruction. So these are some of the major causes of choking in adults. And from the topic, we also talk about children. Let me just mention some of those things that can cause that of the child, like toddler that is creeping in the house, coins. Under this situation, all those children growing, that is about 1 year and above, in the house, anything they see in the house, they will just put it inside mouth, such as baby powder, small trashes in the house, everything they see, they put it in their mouth. Safety pin, coins, even marble, marker's cap, all these they can put in their mouth and it will cause choking to them. The question now is, if somebody is choking, if somebody is choking, what do we do? In fact, do not also give them a chewing gum, those children. Don't give them chewing gum. Now, what are those signs and symptoms you notice in such a person that is choking? One is referred to as cyanosis, pale blue skin, simply mean as a result of lack or reduction of amount of oxygen in the body, especially to fair population person, the lip will be turning blue-black. And so that is a condition we refer to as cyanosis. Another condition you find in that individual is that he finds it difficult to breathe, as well as speaking. He will not be able to speak. He'll be hearing some noise. That's the kind of noise you hear for such an individual. Noisy breathing is also there. Red puffy face with the hands around the throat, telling you that I have some distress, with the eyes bulging out, telling you I am in a terrible situation or a life-threatening condition. The two hands he puts around the neck shows sign of distress, or is referred to as the universal sign for choking. Now, if somebody have a partial airway obstruction, the only way you know is persistent dry cough. Take for instance, let me give you a local dish. If you prepared fresh fish pepper soup, for instance, maybe you just put your spoon and you want to take the first shot or the first soup into your mouth. Before you know, you start coughing. What is the cause? That is an example of partial airway obstruction. You continue to cough. If you have a partial airway obstruction, you do not do anything, but you continue to cough until the object leave that area, the airway. Now, your aim as a first aider, where you see the sign and symptom of choking, is that your aim is how that obstruction can be removed from that individual so that you can restore normal breathing to the victim. And when that is done, it will advise to take such victim to the hospital for proper medical care. Because what you may do to that victim at that time, you may have changed some of the organs from their normal position. That is why it's important for you to take them to the hospital. Now, what you do again is treatment for adults and children. Now, according to American Heart Association, before now, we always have two methods, especially for a situation where the airway is totally blocked. We say use abdominal thrust, according to American Heart Association. But for the best results from our own findings is that you should combine abdominal thrust with giving back blow. It's very effective in dislodging an object from the throat. So you perform abdominal thrust to see that the object is dislodged. And when the object is not dislodged, the victim pulse can stop. The idea of CPRO will come into play. Now, for the child that is choking, you use what we refer to as chest thrust. You compress the chest to dislodge it, and you'll be of the same height with the child so that you can dislodge it. What is age range for the child? 1 year and above, can even say to puberty. But there are some children, when it is about 8 years, it's okay. You can consider it 1 to 8 years. But there are some, before the puberty stage, they are like an adult. So if they look like an adult, then you can use abdominal thrust directly instead of using chest thrust. Now, so that is how you can handle choking for an adult and for a child. The question now is, now, how will you perform the abdominal thrust? That is the question. All you need to do, you bend the body of the victim and you stand behind the victim. You ramp your fist. Like the picture you are seeing on the left-hand side, from where I'm sitting down on the left-hand side, you can see the picture there. That indicates how you position yourself. This positioning ensures that you are stable by putting one of your legs behind and one very close to the victim, and you thrust in, up 5 times. And you ask the victim, are you still choking? If there's no response, you do it again. You ask the victim again after 5 times, are you still choking? If the victim is still choking, then you cannot alternate it with 5 bar blow. And what is the second picture on my right-hand side, the picture close to the very first one. You bend the victim the way it is there, and you give 5 back blow with the heel of your palm. 1, 2, 3, 4, 5. Ask the victim, are you still choking? No answer. Give it again. 1, 2, 3, 4, 5. You continue this process until the object is dislodged. Now, for an infant can as well choke as well. If an infant is choking, what do? You lie the baby face down, you give the baby 5 back slap with the heel of your hand, followed by 5 chest compression, with the head lower than the chest until the object is dislodged. How? You can see the third picture there from my right hand side, count 1, 2, 3. That picture, that's how you position the infant. And with the mouth open, that mouth open shows that the airway is also open. Then you give 5 back blow. You should know that this is an infant. So you need to use your common sense where you are giving the heel of your hand where giving the slap. Then after giving 5 back slap, you turn the baby so that it will face up with the head also lower. Check the mouth if the object is still there. And if you are seeing the object, then you put your hands straight towards one end of the mouth, and you make a swoop. To clear it, make a hook, and you bring every material that is in the mouth there. And when that is done, then check the baby if it's back again, if there's sign of life. Is the baby making his hand like that? Then you turn it the other way. Then you use 2 fingers in between the nipple line, and you do what they refer to as chest compression. You also do this compression 5 times. When you do it 5 times, then look at the mouth if the object is dislodged. If it's not dislodged, you do it again until the object is dislodged. What can cause that of the infants? 1, maybe if it's a child that you are giving pap and the pap is thick, the child can choke. Then a situation where you are breastfeeding the baby and the baby too could have not been able to swallow the first one, can also lead to airway obstruction. That is what can cause infant choking. Now, if a pregnant woman, even though it's not there, a pregnant woman that is choking, what is expected of you is to go to the chest area and you do chest compression on the chest until the object is dislodged. Now that you have been trained in the skill and knowledge of choking, and if you yourself is choking and you are alone, what do? What is expected of you is that look for a stack chair. A stack chair that doesn't have rollers or swivel base and is very strong. Then you make your arm, fold your arm the way you're supposed to do it for abdominal thrust, part the chair, then you put your chest on it, like that man on the last picture on my right-hand side with that chair. Then you pad it.
Presenter, sir.
Yeah.
You have 5 minutes.
Okay, 5 minutes. So that is what you do. Now, if you are doing the choking and the individual now slump or becoming very weak, he can't stand again to withstand that abdominal thrust and giving that 5 back blow. Lay the victim on his back. Look for the navel and put your 2 hands there and you push forward 5 times. 1, 2. 1, 2, 3, 4, 5. Look at the mouth if the object is dislodged. If not, you start that again. But if peradventure the victim heart has stopped to work, that means you are now apply CPR, cardiopulmonary resuscitation, to the victim. And on this, I will say I have come to the end of treatment and meaning of choking. Any question?
Okay, thank you very much, sir. Let's just take the next presentation, and when we come back, we can just take the questions together.
Okay.
And that is to be done by both the present speaker and Mr. Dominic. That means Mr. Owerite and Mr. Dominic will take us on cuts, bruises, bleeding, and burns. So you have the floor, sir.
Okay. Thank you for listening.
Yeah, once again, you're all welcome to this presentation. We want to look at wounds. And by definition, wounds is a disruption in the continuity of the body tissue, meaning that anywhere there is cut in any part of your body, you sustain wound. Wound may be classified into two: internal or concealed wound, or external or open wound, meaning that there are some wounds you sustain and there is no outflow of blood. Also, there are wounds you sustain, you see blood flowing out. So the one that the blood is flowing out is called external open wound. The one that is concealed is called internal wound. Now, we also have types of wound based on their look. Otherwise, wound is wound. Once the tissue is destroyed, there is bound to be bleeding. So we record the types based on the way they are. And the first one is incised wound, which can be caused by a very sharp object, like knife or razor blade. Then we have respirated wound, where the edges of the wound are torn irregularly, maybe like barbed wire or claws of animals. If they hook on somebody's flesh, there's that tendency that is going to pull the flesh out and you see the edges torn irregularly. So that is lacerated wound. We also have the contused wound. And this one is the damage that happened to the internal tissue, where the tissue is damaged, is broken, but the blood is leaking inside it. It's not flowing out. So that is contused wound. Then we also have the punctured wound, where maybe an object pierces through your foot, or you mistakenly match an object, or a needle can even pierce into your hand, and that one can give you punctured wound. Then we have the abrasion wound, where the outer surface is scraped on the floor, and you see the first skin of the person removing, and you see blood coming out. Then we also have the gunshot wound, where the other bullet enter into the body of the person is small, but the exit is always very wide because of the force that the bullet want to use to pull out. So it pulls a lot of tissues or muscles out of that area. So that is why the entry may be small and the back of where the bullet comes out may be very large. And you can see the various photographs there. That is the various cuts. You can see the picture shown there for the various types of wounds. Now, when we sustain wound, what do we do? As first aiders, the first thing is to keep the victim calm, because the more people talk when they are injured, the more there is circulation. So we try not to allow circulation to be much. So we try to reduce circulation. So you keep them calm. Then you stop the bleeding. Stopping the bleeding meaning that you have to apply a pad or get something like a material, use it to put on the surface of the injury directly and firmly, and if possible, you bandage. Then where the wound leads to bleeding so much that the person may go into shock, then you may now need to treat for shock. And like as I said, the treatment for shock is raising the leg above the ground, 12 inches. Now you can, like the photograph I said, you can see the first palm, there is a very sharp cut there. That is incised wound. Then talking about the first, the first one. Then the second one, yes, that one is incised. The second one is lacerated. You can see the edge is torn irregularly, while the third one is a punctured wound. Okay. Then you follow to the other one, you see another example of the lacerated wound again, where the edges are torn irregularly. Then of course, you can see like something piercing down. That's a punctured wound. Shows the sign of a nail destroying the epidermis and the dermis. And that one is a very serious issue because the mouth may be closed. Meanwhile, the tissues that is under is damaged. And so the bleeding may not be coming out. And in this kind of issue, that is where we see people trying to burn oil using the crude way to treat. It is wrong. So we are going to tell you how to treat the wound, which I just mentioned. Stop the bleeding. Just cover the area, stop the bleeding. And for especially this punctured wound, you try as much as possible to get something to pad around the place and take the person to the hospital so that it can be well taken care of. We as first aiders, our major aim is to ensure that we treat the casualty and get the casualty to survive to get to the hospital. So that one will take us into bleeding. Bleeding, as it implies, is a situation where blood is escaping from the blood vessels. The blood vessels is damaged and blood coming out from it. And we also have it also in two, as we all classified into two, which is the internal bleeding and external bleeding. And the internal bleeding too, we also have it in various ways. There is internal bleeding where you can see the blood coming out, or the blood coming out. And where is the blood coming out? Though the blood may be coming out from the natural orifice, that we say natural orifice, like the holes leading to the internal body, you see the blood coming out from those areas. And that is not the area where the person actually sustained the injury. For instance, you may have internal bleeding in your head or around the brain, and at the end, the blood will start coming out from your mouth or from your nose or from the ear. So you may see the blood coming out. That is internal bleeding with visible blood. Then there is some that are internal. You won't see the blood at all. The blood is just draining out into the cavity of the body. And once that is happening, because the blood is not seen outside, makes people take it for granted. And that is where we have seen situations where some people will be involved in an accident and they will come out of that accident and go to church and even give testimony and do thanksgiving that nothing happened to them. Unknown to them that they have sustained internal injury. And before you know it, after some days, you now begin to see some part of that area swelling. And if it happened to the brain or to a major organ, before you know it, that organ will pack up. Why? Because bleeding has been going on, unknown to the casualty. Next slide, please. So in case of where there the second one, like as I said, is external bleeding. For external bleeding, fine. You as a first aider can easily control it because you can see the actual spot where the bleeding is coming out. So for external bleeding to a first aider, fine, you can manage that. Like I want to go back again to that internal bleeding. Please, as a first aider, you have not much to do because you are not seeing where the blood is coming out. So the more you waste the person's time, the more the person will bleed to unconsciousness. So, or bleed into shock and go fall into shock. So what you need to do for internal bleeding, where you suspect the person has sustained internal bleeding, is to quickly as possible take this person to the hospital Very, very important to do that. But for external bleeding, fine, you can see the position where the blood is coming out. And by the time you see the position where the blood is coming out, you can arrest it. You can stop it. And that is where we first aiders can actually do something before evacuating the casualty. And now we have 3 types of bleeding. These 3 types of bleeding is just telling us the various blood vessels where the blood is coming out. We have the arterial bleeding, we have the venous bleeding, and the capillary bleeding. For the arterial bleeding, all you see is the blood coming out in proportion to the way the heart beats. So that will tell you that this person has had a cut in the artery, meaning that because the artery carries blood from the heart. So once any of the arterial blood vessels is cut, you see the blood pushing out the way the heart beats. Each time the heart beats and that place is exposed, you see the blood push out that same manner. So that is for arterial bleeding. And for the venous bleeding, this is blood coming out from the vein. And this one flows because it's supposed to flow back to the heart. And because it's supposed to flow back to the heart, then it just rushes like in form of tap water. So it does not come out the same way like the blood of from the arteries. And another way you know that it is an arterial bleeding also is that when you see the blood from the arteries, it is bright red. Bright red because the blood is still carrying oxygen. The blood is still carrying oxygen. But the one from the venous does not have oxygen anymore. And so if you see such blood coming out, it used to be very dark. We say dark red. Why? Because that blood does not carry oxygen. And here I always tell participants that there is no bad blood in our system. It's just that when somebody sustains injury and you see the blood coming out and that blood is dark, then you know that it is the blood that has no oxygen. It is not a bad blood. So we should do as much as possible to save that area, to stop the blood from coming out so that the person will not go into shock. So it's very important. There is no bad blood in our system that is flowing. So that is on that. Then for the capillaries as a network that links between the arteries and the venous. So this capillary bleeding can carry any of them, and that is where the exchange of oxygen takes place in the body, or the exchange of even the used oxygenated blood and the deoxygenated blood takes place. So the capillary bleeding, you just see it pulls out. The veins or the blood vessels of the capillaries are tiny, very tiny, and they are closer to the surface. And because they are closer to the surface, once it is sustained or there is injury or there is blood coming out, all you see is blood oozing out from that place. When you wipe, as if you are trying to clean the area, you see it just pulls out again. That will tell you it is a capillaries bleeding. Now, how do we control this bleeding? First of all, we need to keep the victim calm. Lie the victim down, because in the management of blood loss, it is very important that that aspect that the person sustained injury should be raised above the heart region. It should be raised above the heart region. So if the person sustained injury on the upper side, it is very important that you lie the person down. Then raise that part the person sustained the injury above the heart. So if it is in the palm, then you have to raise the person's hand up to ensure that much blood does not flow to that part where he sustained the injury. Then you identify area where the person is bleeding. If the place is covered by with cloth, cut it off so that you can actually see the side. Because if you don't see the exact side, you will not be able to apply your bandage correctly. You will not be able to apply your bandage correctly. And it is very important that you apply directly on the surface of the wound or the injury or the place that is bleeding. So that takes us to number 3, that you have to apply your bandage directly on top with little or firm pressure on top of the injury with either clean cloth or a pad or a sterilized gauze. Then elevate that part above the heart level if you suspect fracture. If you suspect fracture and you know the fracture will not enable you to elevate, to raise up part of the body up, please don't do that so that you don't give the person more pain. Remember our aims of first aid. Then you apply a firm pressure bandage to hold the dressing in position. If this bandage gets soaked with blood, put another pad on top of it again. If that same second pad got soaked, then you have to remove the two. And this time you are removing the two that is soaked with blood, you will now be able to see clearly the exact size of the injury. Then you cannot place your pad to cover the entire surface and bandage lightly or firmly. So that is what we do. So if bleeding continues, assuming you are doing all this and the place is still bringing out much blood profusely, such that you now discover that this person is losing so much amount of blood, what do? You are advised to locate maybe the nearest pressure point. Okay, we call it pressure point. That is the nearest area you can feel the pulse. Depress that area down for about 10 minutes to stop blood from flowing. Don't extend it more than that 10 minutes, okay, so that blood can still go to that other part of the body to give the tissues and the cells over there oxygen and nutrients, which they depends on. So you don't cut off that area completely from oxygen because you are trying to stop the place that is bleeding. So that is what you do. When you have finished this one, then you cannot transport your casualty to the hospital. Let us not be too in a haste in any emergency where somebody is bleeding and we have not taken care to stop this bleeding. All our intention is to send the person to the hospital. No, it is wrong. Let us have it in mind that we as first aiders, this is one good thing we can always do to help any victim who is bleeding. Once you discover that the victim is bleeding, please do as much as possible to stop the area from bleeding before evacuating the person. I want us to take note here. We said the use of tourniquet is no more in use. Yes, it is no more in use. But there are situations like the photograph that the next slide, please. Yes, you can, the slide on my right-hand side for the man sitting there. You can see his hand cut off. In that kind of situation, if you don't tie the maybe 2 inches after where that place is cut off, if you don't tie it tightly such that blood will not flow out, this man will still lose much blood that can make him to go into shock. That is a fact. So you need to do a tight tying before this spot that is cut off to enable blood not to flow out so that he can survive. Don't forget, the blood is life. For his case, yes, what do we mean by tourniquet? Tourniquet is just something that you need to improvise or you tie an area very tight to stop the flow of blood to get to that area or that area. So you can do that one for crush injury, where you suspect that it's going to be amputation. You can do that for a case like this, where this man has a cut in his hand. So you can apply that so that the person can be alive. Then every other one, you can try to apply your pad, no matter the size of injury, even if it is the next photograph after the man's own, the one on before the man's own. You discover that it's another major injury. All you need to do there as a first aider is to ensure that you pad the surface very well, the surface that has this cut, where the flesh is removed or the muscles are removed. Pad it very well, tie it, okay? And send this person to the hospital. So we also talk about maybe a bedded object, maybe a situation where somebody is stabbed and the object is left there. Maybe somebody just stabbed somebody with a bottle or a knife and the thing didn't come out and you now decide to, or the thing is still there where you are suggested that if you meet such a situation, please don't remove that object. If you remove the object, you might not be able to control the bleeding because that object is still covering some of the blood vessels from flowing out blood. So all you need to do is to pound around that object to ensure that the person is alive, send the person to the hospital. And I always say this, if the person is alive and even the thing pierces through the person from back to the front or from the front to the back and peel the person down. Cut either that object, send the person with that object like that to the hospital, and by the grace of God, the person will survive. All you need to do is to pan around the object to ensure that much blood is not flowing out, so that when this person gets to the hospital, he might be well taken care of. So that is where I will draw the cutting of these wounds and bleeding to a close. If you have any question, maybe you may ask. Is there any question?
Let's just run down to the end. Who is taking bonds?
Okay, let Agbamokoro come and take the bonds.
Burns are injury to the skin caused by dry heat or wet heat. Burns are generally caused by dry heat penetrating into the skin, while scars are injury to the skin caused by wet heat. When damaged by burning, the skin no longer functions as a natural barrier. The body fluid may be lost as tiny blood vessels leak to form blisters. What are blisters? Blisters are just collection of water under the skin, and you are advised not to tamper with them. Leave them the way it is. Types of burns. We have dry burn. It's caused by flames, contact with hot objects, friction. White scars, you can talk about steam, hot liquids, maybe making hot water for a bath, and you open the lids, the steam just come out. You can have scars. But you can equally have electrical burn caused by low voltage current or high voltage currents, or lightning strikes can cause electrical burn to the body tissue. Cold injury, frostbite, contact with freezing metals, and contact with freezing vapor. For instance, if you hold ice block for a long time, you'll be having that burns, that bite in your hands. Then chemical burns too can also have a direct effect to the skin, especially industrial chemicals or even domestic chemicals. Radiation burn too can also have effect on the skin, which is the largest organs in the body, like sunburn, exposure to radioactive sources. The next slides. Now, because of time, I may not go into the classification of burns, but they are classified according to superficial burn, partial thickness burn, and full thickness burn. When somebody sustains burns injury, the bottom line to us as lay person is how you can reduce that potential energy that is penetrating through the body tissues. So that is where I will go to because of time. So move to the next slide. Let's look at the management. Yes, the aim and treatment of burns. Your aim as a first aider one is how you can halt or stop the burning process. And again, try as much to minimize the risk of infection, especially if the skin is open. Then look at the injury associated, treat all the injuries that are there. Then for severe burns, you must seek medical advice. Now, I want to say this generally. If an individual has burns, please do not use these materials. Olive oil, raw pap to rub the affected parts, mud with water to put on the affected parts. No. All those, or raw starch to rub the affected parts. I will say no, do not do all that. Because if it is a kind of a severe burns, it will take the doctor a longer period to remove those material before treatment can be effective. So which is the best treatment now for the individual? One, try as much as you can to douse the area with copious amount of water. And you can introduce some cubes of ice block into the water, not just small bowl of water. The water should be much depending on the affected parts. If it is affecting your, maybe your palm or your hand, get a bucket, dip your hand inside, good quantity of water, dip your hand inside and remain there for about 15 to 20 minutes. And you remove your hands. You will not even remember that you have a bomb before. Then again, if you are wearing maybe a wedding ring, please you're advised to remove it before the area begin to swell. Because if the area begin to swell and that ring is not removed, it's going to constrict that area and blood will not flow to that affected part and the cells in that area will die and that finger or will be cut off. Then jewelries too. Jewelries transmits heat. So if any person is putting on jewelry, such jewelry should be removed immediately to reduce the impact on the body. Whereby the skin is broken, cover the area with sterile material. But like the definition of first aid, he said use material available at that time or at the scene of incident. So any material you can get, use it to cover that area to prevent infection. But for full thickness burn, much fluid will be lost. Under this situation, much fluid will be lost. So you advise to cover the area with polythene bag and you take the person to the hospital. So ladies and gentlemen, this is how I'm going to look at burns and its management. Please, you may ask your questions. Thank you for listening.
Thank you very much. We've come to the end of the second phase of this lecture or training. Now it's time to take the questions. So I think there's a hand up already. Let me take Festus Orepo. Go ahead. Festus, go ahead with your question or contribution. Unmute yourself, Festus. Listen. And any other person who have a question should please raise, just press the raise hand button. Let us recognize you.
Hello, good afternoon.
Afternoon, go ahead.
Sorry, I didn't know I was still muted while talking. Thank you very much for this laudable session. I really want to appreciate the executives and all our presenters. And I'll say this has honestly been a comprehensive session. And for me personally, even though I'm equally a trained first aider, I do not take it for granted. So I really want to appreciate every of our presenters and the executives, as it were. Mine is basically like contributions anyway, and maybe I can raise one question as I go on. Being that as it may, I know the essence of this section is for us to be aware as a first aid. And one thing that is very key is the fact that all these things are actually judged towards saving life. We should always be conscious of the fact that if there's somebody who is in danger, everything that we need to do, we need to ensure that we are time conscious. We put time into consideration. this will go a long way to help us. And in addition to that, I just want to, I don't know if our presenter has mentioned this, it's always very good to equally have first aid boxes even in various homes. It's not that costly, and most importantly, there is first aid handbook. Everything that has been said today, you know, we cannot always digest everything in one go. But with first aid handbook, it will go a long way even to help us to bring to memory all these things that have been said. And lastly, is just a question. I don't know, maybe by the time my internet knocked me out, maybe this has actually been discussed. I just want to put this question to our presenter that I don't know if mention has been made of the use of deep defibrillator during CPR. Thank you very much.
Okay, thank you for the question. So any of our facilitators?
Yes. Yes. Another question from Alaka, Edward.
Okay, Mr. Alaka, go ahead.
Yeah, I appreciate the lecture. It was a very wonderful one, unexpectedly, and then everything there was key. And I appreciate the presenters, they did very well. But what I'm trying to request from the moderator, is it possible for us to have documentation of all these lectures, if we can send it to our email so we can have a record? Thank you.
Let me quickly respond to that. We have this recorded on our YouTube channel. You can go back and rewatch it. Is that documented?
Okay, fine. That is okay. Thank you.
Okay. So the facilitator, the last question, the question raised by Festus, can you respond to it, please?
Is it the use of AED?
Yes, whether it was mentioned during the course of the lecture.
Yes, it was mentioned during the course of the lectures, but we said that we may not be able to have AEDs in our homes, right? But when you are working in an establishment, AED should be one of the items that should be there, because we have made it very clear that when you are doing CPRO, you're only doing it to buy time until the AED arrives. And early access to it will help in the course of saving a life. One thing is having the AED, and the other is knowing how to use it. So I want to believe that as we progresses, if we have the opportunity in practical sections, we'll have the AEDs for real practical demonstrations, when and how to use them. Because you don't just apply the AED. The good thing there is that, like I mentioned during the course of my presentation, in those days, it is only the cardiologists that are meant to use the AEDs. But now, they have been so simplified for first aiders to use. But of course, if your budget can carry it, you can say have it to your home. It's very possible. If your budget can take it, you can have it to your home. Otherwise, I would have just said it's good for some companies, establishment, and so on. Thank you very much. And let me, I don't know if there are other questions, otherwise I want to.
Thank you, sir. There is no hand. You have something to say?
Yes, I want to really appreciate every family, every member of ASSP for the interest in this aspect of life saving. In sincerity, myself and my team, we are always happy to hear people who want to get involved in the cause of life saving. Like today, we just discussed to bring ideas. We have named it an awareness program. You see, for those of us who are already present today, I want to advise that you should expand on your interests Especially your interest means that you will find time to go, like somebody was talking about first aid manuals and all that. Find time to look at it at your free time. Find time, you can have some videotapes, you can have some CDs or CD-ROMs and all that. You can play them at your free time, not only watching African Magic or how do you call those Filipino Telemundo or it's more common one these days. But if you still find time, the Z World. So find time to look at. There are some video clips on life saving. Find time to look at, looking at them occasionally, especially when you are with your family at home. Because when you who have more knowledge becomes the victim, then the family will children know what to do. So I really want to appreciate every one of us for all that we have done today, for finding time to really listen in today's presentations. I want to thank the president. I want to thank all the ESCO members. I want to thank the families, especially those that were actually present during the demonstration. Thank you very much.
Thank you very much, sir. We appreciate all our facilitators for the time they took out to share this rich knowledge with us. We have a certificate before the president closing remark. There's a certificate to present to you individually. I'm just going to display one of it. The other one will be emailed to you individually. Like I said before we went on break, there's opportunity to have a certificate from the presenters. They are certified to issue certificates. So for those who will be interested in it, you will get further information as the president gives the closing remark. So let me share one of the certificates. Okay, there's the certificates for the presenters. This one of it, I'm just going to present to Mr. Ibe Dominic for volunteering in ASSP Nigerian chapter as a facilitator on state awareness training for ASSP members and family. We appreciate all of you. We are going to send it at individual. Thank you very much.
Thank you.
So, congratulations. Okay, President, over to you.
Thank you, moderator, for a wonderful session. Thank you. It's been a delightful period shared from.
With all due respect, President, can we see your face?
1 p.m.
With all due respect, President, can we see your face?
Okay, sir. Oh my goodness. I was trying to take off video so we don't get interference. Can you see me now, sir?
That is okay. That is okay. Want to see your face. That's good. Thank you.
Thank you so much. Thank you. Thank you. Okay, I am thanking everyone that had made today a reality. Special thanks to you all. We can't thank our facilitators enough who had decided to share their wealth of experience with us. We want to thank you. It's been a wonderful thing. Thank you for sharing your impact. The knowledge for us was so impactful. I want to thank all participants, from our students to our guests, to executives, to the media, to the facilitators, and even for our global guests. Having our vice president in our midst was a very wonderful one. I am very, very grateful. It was, it did a very important training that we felt we should all gain from. And so we had met this team who are first aiders and facilitators to be able to bring it to us. We feel that if we train our hands and share this knowledge within us, we'll be able to help more people volunteering in giving medical aids, especially to us as members and to our immediate family. We tend to take this training to the public, ASSP bringing it as a way of giving back to the society. So we're going to be printing banners, we're going to be having posters shared everywhere, the various zones that ASSP is present. And then we will take this team around. So members in that environment will join on specific days that will be shared to us. And we'll be able to go to radio jingles and then share and allow people come. And then we train them also for free, so that when we have accidents on the way, we can have people come out willingly to help, knowing what to do. So those that will be interested will have a lot to gain. Moving forward, we had appealed to this team to help organize for us first aid certification in first aid. For those that will be interested, for some of us, we are going to be doing it as refresher courses, while some of us have not had certification on first aid. So we'll be consulting them shortly, and then we'll let you know when, of course, they are going to give us ASSP price. You are hearing me now. Something that will be affordable for our members, so that we'll get certified. And any way we can flag out our ID cards and want to help. That, they say, we don't do it on Zoom because there are a lot of practicals involved in it. I think it's a 1 week training, if I'm not mistaken. So it will come on to be able to help solidify this training we had just had. For those that will be interested, we will let you know. So watch out for a lot of trainings. Throughout this chapter here, we are aimed at developing human capital development, increasing our wealth of experience and knowledge through expertise and through certification trainings, so that at the end of this chapter here, we can look back and say, yes, a lot had been put in us as professionals. And then we'll also be able to look at what we have done to the society for them to see ASSP present. So we'll let you know as our programs unfold. Please be part of it. If you're not part of it, then it will be successful. That's why I'm really appreciating as many that took out their time to attend this training today. We're really very grateful. Thank you to media. Thank you to the executives that have been behind this, working around the clock. Thank you, our able secretary who had moderated for us today, our president-elect, our director on training, our students, the student presidents and his team were here. I want to thank each of every one of us. I'll leave the vote of thanks to the training director to do, but I'm so overwhelmed and happy for the success of this training. God bless you all. God bless you all. Thank you.
Thank you.
Thank you very much, President. Can we call, let's call on Dr. Okando to give the vote of thanks.
Is he hearing me now?
Dr. Okando, can you give us a vote of thanks?
Yes, I am on queue. I am on queue. I'm on queue. Good evening.
Good evening.
Good evening, sir.
It's like we've lost him. Maybe we'll have the PE do it.
Okay.
Okay, Dr. Okando, are you back? Can we hear you?
Can you hear me?
Yes, go ahead.
Yes, we can.
let me keep this in here. I'm coming. Can you hear me?
Yeah.
Can you hear me?
Yes.
Can you hear me? My network
We
is
can
coming
hear
and
you,
going.
sir. Okay, keep talking, sir.
Can you hear me now?
We can hear you, sir.
Dr. Okando, go ahead. Just talk. We
Yes,
can
okay.
hear you. Okay, without wasting much time, P, let's go ahead. You can do the vote of thanks on his behalf and then farewell.
Okay. Well, on behalf of ASSP, I want to appreciate all of us that have taken our time to attend this. Yes. Hello?
Dr. Okando, don't worry. The president-elect will take the vote of thanks on your behalf. I think your network is not good enough. Thank you, sir.
Hello?
Yeah, P, over
I
to you,
really
sir.
want to appreciate each and every one of us that take off his time to make sure that this become actualized. We really appreciate, and to our president, you really impacted on us. It is a laudable effort. If we continue to go on with this kind of innovation, it will go a long way to help us, to help our family, and help our nation as whole. We really appreciate each and every one of us. And I want to really add up together, since I'm to make a goodbye for you. I want to make sure that each and every one of us has reached his various destinations safely. It is really a laudable effort. I want to thank you all for participating in our training and knowledge sharing series for October. I coordinated this month and we had a training in ergonomics and risk management. It was a great experience. I thank the presenters for volunteering to share their experience with us. And to all the participants, thank you for taking out time to attend this, our important session, particularly our family that live whatever they are doing to ensure that they actualize this important gathering. Next month, don't forget, is the November, and it's the safety in transportation, which is to be coordinated by our ambassador, Mr. Felix Nakodia, who I can say our grandfather in safety. Please make out time to join us. On behalf of ASSP NC, I appreciate you all and say goodbye for now. Thank
you very much, sir. We appreciate all the audience.
Thank
and
you very
we
much.
hope to see you again.
Thank you very much.
Yes.
Thank you. Have a
Thank
wonderful
you.
day.
Thank you all.
It was a wonderful section. Thank you to all the organizers and everyone.
Thank you.
Thank you, Mr. Festus. Thank you.
Sorry, we're supposed to have